Hello, I'm Dr. Brandt Gibson, and one of the things we talk about on a regular basis with neuropathy is getting sufficient nutrition and sufficient fluids. And when we're talking about fluids or water, we're talking about anywhere from 8 to 12 cups of water a day. And really what I want to do is help you understand why. Adult humans are 60% water, and our blood is really 90% water, so there is significant benefit to fluids when it comes to overall health of the body, including lubricating the joints, the ability for the blood to carry oxygen throughout the body, cushioning of the brain, spinal cord, and other sensitive tissues, regulating body temperature, flushing out body waste. But where does this all apply, or how does this all apply to the nutrition of the nervous system? Well, let's just go through some of those that we just talked about, saying, okay, delivering oxygen to the body. One of the big things that can affect the nerve health, nerves are very sensitive cells. If you're not getting the sufficient oxygen or sufficient nutrients to the cell, then you're going to have a nerve that's not that nerve that's not functioning, that's malfunctioning, and overall is starting to die. If you don't have the cushioning that you need around the nerves, around the spinal cord, around the brain even, these peripheral nerves are going to have a harder time communicating with a less functional brain. Body temperature, same type of thing. As you modify body temperature, you start to damage some of the more sensitive type tissues. One of the ways that we carry nutrients to the body, including minerals, is through the fluids. Most of the minerals, most of the nutrients will dissolve in fluid. So oxygen, of course, is carried by the red blood cell, but nutrients are usually dissolved in the tissue, and that's dissolved in the fluids in the blood, and that's how they get around. So if you don't have sufficient fluids, then you're going to have problems with that. Do we have proof of this? Well, studies show that even mild dehydration, such as a loss of 1.4% in young women and 1.6%, I believe it is, in young men, that you will get a impaired mood, impaired concentration. You will have detrimental effect on the working memory and increased feelings of anxiety and fatigue. So basically, you're decreasing the functioning of the brain and spinal cord, which are the most direct effect on nerves that you can actually see. So you can say, okay, we're affecting the nerves that are in the brain and in the spinal cord. It's going to also affect the nerves in the peripheral nervous system. What are some of the other things that happen with insufficient fluid? You get the gastrointestinal function will be decreased. And so you're saying, okay, how is that going to affect the nerves? Nutrients are absorbed through the gut in most cases. So it's going to be the food you eat and so forth. So one of the beneficial reasons why eating more fruits and vegetables help the nerves is it also increases the fluid content, because some fruits and vegetables actually have a higher amount of fluid in them, so you're going to get more fluid from that. So fluid comes from what we drink. You get a small portion amount of fluid from breathing, but you get the other amounts of fluid in the body from what we eat. And so fruits and vegetables have a higher fluid content. They're going to decrease your chance of having dehydration by that. You'll also increase the function of some of the systemic tissues of the body, like the heart, the lungs, the kidneys, the liver. So when it comes to toxic substances in the body, increasing the fluid content will help the kidneys and liver function more appropriately, and they'll do a better job of removing toxins and removing toxic tissues, decreasing toxic neuropathy by decreasing the effects on the system. Hydration is also very, very valuable for treating a lot of different types of chronic diseases, because they can actually improve many of these disease processes and make them less of a problem. For example, let's do some simple their higher intake of water is associated with a lower risk of fatal heart disease. In diabetes, dehydration promotes development of hyperglycemia, or diabetic ketoacidosis can also occur because of decreased fluid content in the body. So when it comes to the peripheral nervous system, any amount of fluids that you can take in as an increase from what you're currently doing will improve the overall functioning of that nervous system and ultimately be a benefit. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 310, fluid and peripheral neuropathy. You want to get sufficient fluids, which is, from our research report, we've seen 8 to 12 cups of water a day. Thank you. Have a great rest of your day.